Now, we are streaming live on YouTube at the moment. We are live on YouTube, and our handle is the Healthy Living Shows. Just go to your YouTube and search Healthy Living Shows. Yeah, thank you so much. And don't forget to subscribe. Just click on the subscribe button and also the small notification button up there so that you can get our notifications once we're live. This show is proudly brought to you by Saladmaster. Very shortly, we'll be going to the studio where we have Dr. Dolly and, of course, Mr. Tony Bello standing by. And Dr. Dolly promises actually to bring us some amazing information tonight on diabetes, just continuation of where she left off yesterday. So if you were not on the show yesterday or yesterday afternoon, probably due to work, you could also watch the recorded edition on our YouTube handle. So please, that session is available for you to go and revisit whenever you want to do so. Now tonight, we'll be continuing from where she stopped, and it promises to be exciting. You could ask all your questions using the Q&A button on the top of your screen. And for some people, it's just at the bottom of your screen, and you can send in all your messages. So thank you very much. I think I can see pictures coming through from the studio of Dr. Dolly and Mr. Tony Bello. I can see pictures coming through, and they're just going to be live with us shortly. So again, welcome on the show. Thank you, thank you, thank you. I can see your messages. Just want to check. Dr. Dolly, can you hear me? Okay, Mr. Tony, can you hear me? Okay, I think there's a slight technical challenge, which is going to be sorted shortly. But like I said earlier, thank you so much for coming on the show tonight. It promises to be an exciting one, promises to be engaging. You could ask all your questions relating to diabetes. Yesterday, Dr. Dolly actually focused on some very important and key areas when it comes to the issue of diabetes. She talked about the diabetes, the stage 1. She talked about also some other things relating to gestational diabetes, and she actually enlightened us yesterday. And today she will do justice to the rest of the issues she couldn't handle yesterday. Okay, so our pictures are back. Hi, good evening. Can you hear me, Mr. Tony and Dr. Dolly?
Good evening, Marvel.
Good evening, Marvel.
Right, I can hear you now, loud and clear. Thank you. Good to see you guys. We are expecting that this show tonight will actually be what everyone has come on for. So thank you very much for coming. I'm going to hand it back now to you in the studio. Over to you guys now.
Hello, good evening, Saladmaster, good evening, the world. Thank you very much for coming back on the show with Dr. Dolly on the $1 Billion Body Show with diabetes. Yeah, over to you there.
Okay, thank you, Mr. Tony. Good evening, everyone. Thank you for coming on to the show. We promise today for it to be a very enlightening and jolly ride for all of us. We're still on your favorite program, Your $1 Billion Body, and we're handling the topic of understanding diabetes. And this show is also proudly sponsored by Saladmasters, and we welcome you very much today.
Well, Dr. Dolly, yesterday was a big show, We've talked a lot about, I mean, I'm just going to share with you some of the things I learned yesterday.
Okay.
You know, they're not three types, there are 2 types of diabetes. Okay. Type 1, am I right?
Yes, you're right.
Type 2.
Yes.
And then there's this
gestational diabetes.
Gestational diabetes.
Yes.
Wow, that's on pregnant mothers, I think.
That's right.
Wow. Yeah. We've got a lot of information. There were some questions yesterday that people wanted to ask, but they're gonna pull those questions onto today because it was so much and we had so much to do. And this show, we're gonna pack it all in and make sure they get all the nuggets, all the
Oh, yes.
information.
Oh,
You
yes.
know, and we learned something about like things that you should be looking out for, the features, the
Yes.
the things that are
The
telltale
risk-
signs.
Yes, the
Telltale
risk
signs.
factors.
Risk factors, yeah.
Yes.
So today, what do you have in store for us today?
Well, today we are going to continue from where we started. We stopped yesterday. So we are going to complete off on complications of diabetes type 2, and then we now go into the treatment. And after treatment, we do the prevention and we wrap.
Wow, we wrap. I like that wrap. Yeah.
Yeah.
You know, guys, please get your pens, your paper, pads ready. Get your questions ready because this show is there for you. It's for you. And thank you very much for Saladmaster for sponsoring the show. Thank you very much for the Excel region in Nigeria for sponsoring the show. And without further ado, I'm going to hand you over to our capable Dr. Dolly for the $1 Billion Body Show.
Okay. So here we are today, and we are going to dive hands and feet right into diabetes. Let's do a little recap of what we did yesterday. Yesterday, we introduced diabetes and said that it wasn't just one disease, but a group of diseases which are chronic and metabolic diseases that have the similar facial or high blood sugar, or you can call it hyperglycemia. And then we went ahead to talk about the types. We have, like Mr. Tony said, we have type 1 diabetes, type 2 diabetes, and gestational diabetes. We also went ahead to discuss in depth about the risk factors. Risk factors means who is likely to come up with diabetes. If you had it in your family, we now saw that it was more prone to the white population as against blacks. And then for the ages too, type 2 is for 40 and above, type 1 is for younger population. And then we also went to the clinical features. We also saw some of the complications, and then we had to look at the signs that a diabetic type 1 patient will be showing, and you know that this is an emergency, you need to take the person to the hospital. So now, today, we're continuing from complications of type 2 diabetes mellitus. Well, it is usually seen in 15 to 20 years after hyperglycemic onset. So when you're diagnosed of diabetes today, you don't just start having complications until maybe 15 to 20 years after the onset. And then you have hyperglycemia as part of the complication. Hyperglycemia is when you have high blood sugar in the blood. So it manifests as heavy thirst. You're thirsting because the sugar in the bloodstream should have left the bloodstream to go into the cells, and it's not going into the cells, making the cells in the blood to be more than what it usually is, and reducing the volume and making people thirst, even though the body has the adequate amount of fluid it requires. But due to the raised osmolarity, or what we call more particles or molecules being in the blood vessels, you now have more molecules, and then you need more water to dilute it. So that's why the test manifests. Then again, you have diabetic foot ulcers. You know, in diabetes, there's usually blood vessel damage, especially to the extremities. Extremities means my hands and my legs. So if you're a diabetic and you're not careful and you hit your leg on a door or any stone or anything, it hardly goes. And when it's there from just a small cut, it spreads. Some of them end up with being amputated on that leg. So it's a very, very serious complication of diabetes. Then again, you have what we call hypoglycemia and hypocalcemia. Hypocalcemia is low potassium in the blood, complication of diabetes type 2. You also have sepsis. Sepsis is an overwhelming infection. It has gone systemic. It is no more an infection that is just in the leg or hand or stomach. It's now all over the body. That is sepsis. And these are usually very fatal complications. The second one is now, the second one is, I grouped it in macrovascular diseases. It's not just one. Macro is the big blood vessels. In diabetes mellitus, you have accelerated atherosclerosis of the arteries, meaning hardening of the arteries. When arteries are hard, it becomes stiff. Unlike when it's not hard, it is malleable, it can move and permeate to even smaller organs, because every tiny detail, even a single hair on the skin, receives blood, and it is through these very malleable vessels that the blood come. But when the vessels are now strong and stiff, blood vessels cannot meander to those very, very minute organs to supply them. Now, another one is myocardial infarction. This is heart problem, what we usually call heart attack in normal pilots, and it affects about 80% of diabetes, and it causes their death too. Another very big complication is stroke, because stroke is something that occurs inside the blood vessels of the brain. So it's also a complication of diabetes mellitus. And the last on this is lower extreme gangrene. Like I said, the extremities, blood has a problem of supplying them in diabetic patients. And therefore, if you have a wound there and the blood doesn't supply there, the wound turns black. And when it turns black, we now say that the wound is gangrenous. And the only option at this point is to cut it off before it infects the other parts of the body.
Wow, wow.
Yeah.
There's a lot of issues with diabetes.
My God.
So really, diabetes is when you have diabetes, you're not just worried about having diabetes. It's the complications and all the things that come on after.
Yes, the complications are what makes it very debilitating. It must change your way of life.
Wow.
So that's why we are emphasizing on prevention if you haven't got it, and if you get it, adhere to your medications, because being compliant with your medications can make the complications to come maybe even beyond 20 years. Yes, if you're managing your diabetes well, 30 something years into the diabetes, you will hardly get any complication.
Right.
But if not, if you don't take it serious and don't take your medication, don't go for follow-ups in the hospital, the complications come quicker.
Wow.
Yes. Wow. So the next one is microvascular diseases. We did, the other one was macro. Macro is the bigger blood vessels. Now is micro, the smaller blood vessels that supply blood to each of your skin, every hair, all the small places, even in the eye, the white part of your eye. There's a way you rub it, you start seeing something red passing there. Yeah, those are blood vessels, and diabetes affects them. So the first complication of the microvascular complication of diabetes is what we call diabetic retinopathy. When you have retinopathy, it is affecting solely the arteries that supply the retina, that is the eye. So diabetic patient is always having problem with the eyes. They're coming up with blurring of vision. They usually have cataract and all of that. It is due to diabetes in the blood. The next is also kidney. When the small blood vessels in the kidney are affected, we call it diabetic nephropathy. Nephropathy now are the small vessels which are supplying the kidneys are affected by diabetes. And as such, you have what we call diabetic nephropathy, and it is the chronic cause of kidney diseases in Nigeria. Yes. And when you have this diabetic nephropathy, you also have increase your risk of getting cardiovascular complications from diabetes. So it's all linked. It affects every organ virtually in the body. Another one is autonomic neuropathy. What does it mean? It means that the autonomic means unconscious. You breathe. It's not every time you take a breath that you know that you've taken a breath. It's not every time. How you feel the urge to go and ease yourself in the toilet, that's the body's own problem. Your own is to feel, when you feel the urge, you go and empty your bowel. That's it. Now, when these nerves that is controlling these unconscious or autonomic activities are affected, as usually is in diabetes, you now have what we call sexual impotence, especially in the men, in the males. And then you have bladder or bowel dysfunction. You can no longer control your bladder, you can no longer control your bowel. That is what diabetes and complications does to a person. Another one is diabetic monopathy. What does it mean? It means that you might be having patches. If you come here, it's like a burning sensation. It comes here, it comes to the back, it comes to anywhere it chooses, anywhere that the nerve is affected. It can just give you a focal neurologic impairment. And when it does that, you need to go and see a doctor fast. Another one, a complication of diabetes. Now, this one doesn't occur in the blood vessels, but outside the blood vessels, in the cells. It is called diabetic ketoacidosis. This one is the one that makes patients rush to the hospitals.
Right, okay.
Yes, because they likely might be in coma. They are usually rushed to the emergency section
Really?
of the hospitals.
Wow.
Yes. When I was a house officer, a diabetic ketoacidosis patient was my first the first emergency I handled.
Wow.
Yes.
Wow.
So it is very, very serious. Usually occurs when there isn't enough insulin in the body. And this condition is triggered by infections and other illnesses you can get when you're also having diabetes. And the symptoms are, the person might, before going into coma or confusion, the person first of all presents with thirst, asking of water, I need to drink, I need to drink. And because of that test, there's also frequent urination. They will come down with abdominal pain, weakness. And then when you, as a relative, go close to that person, you will perceive what we call fruity scented breath. The person will be smelling like he just ate fruits, but yes, it's
Wow.
fruit. Yes.
Wow.
Why
Why is that? Why is that?
It's because of the ketones in the body.
Right.
Yes, it's because of the ketones in the body. If the blood vessels, because when we talked about the pathology of diabetes mellitus, we said that the glucose, which is supposed to be in the body, inside the cells, are now in the bloodstream where they are not utilized. So the body has to have energy to move. So it goes to use fatty acids instead of glucose to get its own energy. And the byproduct of using fatty acids to get energy, it gives you ketones.
Right.
Yes, and when it's so much in the system, the person can go into coma.
Wow.
Yeah.
Wow.
So also the person can also present with confusion and then coma. Another complication of diabetes also is we talked about it. When you have diabetes complication, you are likely going to be in a hospital, in and out of hospital for so much time, that is when it now starts eating on your lifestyle, starts distorting your way of life. That's when it starts affecting you really hard. And that is what we don't want. And when you are managed very well by a good physician, you shouldn't be up to that point. And complications of diabetes causes in-hospital mortality rates of 43%. Mortality rate means death rate in diabetes.
Wow.
Yeah.
Wow.
So that's
43%.
Yes, 43%.
That's a big percentage.
It is big percentage. It is a big percentage. But with some enlightenment and the hospital visitations, the patients can overcome all that.
So these are all complications.
Yes, these are all complications of
And
diabetes type 2.
Type 2. I was just going to say, this is type 2.
Yeah, that's right.
But are these complications still in type 1, or is it just specific to type 2?
No, it's not just specific to, okay, most of them are specific to type 2.
Yeah.
Yes, because yesterday we finished that of type 1. So we don't have time to go into that. So if anybody really wants to know the complications of type 1, they will just go to YouTube and check out the previous
so if someone has
show.
some of these complications, some of these things, because they say complications, like you say complications. So that means they've already been diagnosed with diabetes. What if they're not diagnosed with diabetes? And they have some of these things happening to them? Is this also some signs or some warnings? Or would somebody, what I'm saying in a nutshell is, if somebody doesn't know they have diabetes,
yes,
and they have some of these things happen,
to them,
could it mean that they now need to go and check whether they have diabetes?
Usually in Nigeria, that's how the patients present. Yes, they present in complicated diabetes instead of straightforward diabetes. Now, when they present in this way, the prognosis is very bad. Yes.
So really what we're saying is it gets to the position where it's really terrible.
Yes.
Yeah, and then they now come to the hospital to try and repair something, and then they come to the hospital to try and repair something, and then what's happened? They now find out they have diabetes.
Diabetes. Wow. Not only do they have diabetes, and the diabetes is now going ahead to be complicated. Yes. Wow. So this is the time that we.
So is there any hope for them then? If they get to the point where they have these things without knowing it's diabetes?
Yes. So it's at this point, you are not doing anything for them much because the damage has been done. Yes. Really? You're just doing what we call palliative treatment, easing the pain, making them comfortable, not really doing anything because it has gone way beyond for you to intervene.
Right, okay.
Yes.
Okay. So really what you're saying is you should go for regular checkups.
That is it.
Regular checkups.
Because diabetes creeps up on people. So when you go for regular checks, you can nip it in the bud.
Okay.
Yes.
Okay. So too many checkups. I mean, sometimes people go, I don't want to hassle my doctor. You know, do you think they should hassle their doctors?
I think they should, because the doctor will be happy to have you catch you at the level of glucose intolerance than get you when you're already complicated with diabetes.
Okay. But then they're thinking about money.
No, it's not about money. Glucose testing is one of the cheapest tests we have.
Really? Okay, okay. So go for a test. Go for a test. It doesn't matter whether you think you have it or you don't have it. Go for a test. Listen to Dr. Dolly.
Yeah. Okay. Especially if you're 40 and above, it's advisable you do interval checks.
I always get scared when you say 40 or above because, you know, I'm 40 and above.
Okay. No, but that is preemptive, you know.
Just a question.
Okay.
How, if you're 40 and above, or above, sorry, how regular should somebody go for a
hospital check? Okay. If you're healthy, once a year is okay.
Once a year,
yes, once a year is okay. But if you have if your body has been telling you some things, I mean, you should check it the first time. Then the next 6 months, there's nothing wrong with checking again.
Okay. Yes. So like twice a year.
Twice a year is perfect.
Twice a year. Okay. Okay. And when you go for a check, what should is it just a general check or it's related to?
Well, I should advise a general check.
General check. Okay.
A general check.
Okay.
Yes. Yeah. And if you go to hospital and tell them, I want to do a general check, they know exactly what you mean. Yes.
Well, I know some people watching this program are thinking, do I have diabetes? You know, so it's good for them to just go for a check now.
Just go for a check. I mean, it's not a death sentence.
Okay. Good.
No. Good. Now, another complication of diabetes now is they are prone to infection. Infection of the skin, infections, tuberculosis kind of infection, pneumonias, COVID-19, like we discussed when we had COVID-19 show here, we discussed understanding of COVID-19. We said it there that diabetes mellitus, when you have it, predisposes you or opens you up to have COVID-19.
So really what you're saying is that there are people with diabetes are at threat with COVID-19.
Yes.
But what can they do about, because I know some people probably have diabetes and they're watching this show and they're thinking, oh, this has made things worse.
Yeah.
But what can they do to kind of like protect themselves or, you know, what can they do?
Well, we should look at them the way we should treat them the way we treat the people who are maybe like 70 and above, because I took notes and noticed that in England, when such happened, the Queen was having contact with the outside people were limited. Yes. So I think if you just follow the rules of wearing masks when you're in public, using your hand sanitizers, often washing your hands, I think that is it. And then avoiding crowd and going outside if it's really not necessary.
I suppose obviously they probably have to do regular checkups of their sugar level or so.
Yes.
Would that also help?
Oh yes, because the more controlled your diabetes is, the less you are to having infection.
Right.
But if you just leave it like that, anything that comes, you catch.
Okay.
Okay. So now, before anybody presents in a hospital as in a coma or stuff, there are warning signs that diabetes complications will give you for you to know, oh, I should visit my doctor if I haven't. Or even if you recently visited him and you started noticing these things I'm about to tell you, you should go for a visit. Number one is numbness and tingling of the hands and feet. When your hand is numb, you can't feel anything. You're holding a napkin, but you really can't feel it. That is showing you that the nerve in that hand is affected and you should go see a doctor. Another one is reduced vision. Like I said, why we have diabetic retinopathy, which means that is setting in. When your vision is blurry, reduced, or you're looking at a distant object and it looks like there's harmattan in you're in a harmattan season when there's nothing, it's just a sunny day and the vision is appearing hazy, you should go see a doctor. That's a warning sign. Another one is when you're experiencing impotence or erectile dysfunction. That's also a sign to go running to your doctor. The other one is hypoglycemia. Hypo means reduced level of sugar in the blood. This is very dangerous because a person can actually die from it. Okay, let me just take this lesson and just give a story about my roommate that had hypoglycemia. She had diabetes type 1 when we were in school, and she happened to be a roommate of mine. So she never told anybody what she was suffering from. We didn't know until we walked in on her one day lying on the floor unconscious. So, but we were medical students and we had the teaching. So we're like, okay, let's just take 1 cube of sugar and put into her mouth. Immediately she took it. It was like magic. Her eyes opened. And she was like, what am I doing on the ground? Well, like, you passed out. Do you have diabetes? She said, yes, she had type 1. Eventually, we now called a meeting of all the roommates and let everybody know her condition. So in case of anything or she's met lying on the floor, just 1 cube of sugar can do a miracle. Eventually, she left the school and went visiting to people from other universities and didn't tell anybody that she was diabetic. She passed out on their way to going to a friend's birthday party, and she collapsed on the road and they all left her there and she died.
Oh,
yes.
terrible
Yes.
story.
Just 1 cube of sugar would have done the miracle.
But I always find that when we talk about diabetes, we don't talk about diabetes and sugar in the same context. We kind of, isn't sugar the enemy?
Exactly.
So why should it be the friend in this case? I thought sugar is the enemy.
Yes, sugar is the enemy. Usually they present with hyperglycemia. Okay. Now, because I said what I said about autonomic nerve being affected, autonomic nerve means the nerve that is in control of activities that that is unconscious in you. Now, hunger is an autonomic activity controlled event. So if people with diabetes, they don't feel hungry because the nerves aren't working as they should. Okay. So they sleep, their blood sugar gets used to the very lowest and they won't know. The next thing you know, they're passing out. So they don't feel hungry like you. No, they don't, because of nerves being affected by diabetes. So that's why. So now in this case, sugar is now the friend. Because if you give, the brain can't survive like 5 minutes stretch without glucose. No, it can't. Okay. All right. And then there's another warning sign of diabetes complication. Some people used to develop dark patches in the neck, armpit, or groin areas. We'll call it acanthosis nigricans. When you have such, you see such maybe armpit, neck, or groin, you see a black patch that is there that is usually not there, and you know that you're diabetic, rush to your doctor. Now, when you come to the hospital, like Mr. Tony said, how do you test for diabetes? How do you even know that you have diabetes? What do you do? How do you diagnose diabetes mellitus? The first diagnosis you do is, first of all, doctor will tell you that you're coming to do what we call fasting blood sugar. In this fasting blood sugar, you usually fast overnight, like you eat in the morning, afternoon, then in the night, let's say 7 p.m. No more food till 7 p.m. the following day. You go to the hospital without breakfast and go to be tested. Your blood sample will be collected and you wait. When the blood sample comes, your blood sugar, if it is anything greater than 7 millimole per liter or 126 milligram per dl, that is diagnostic of diabetes mellitus. Because normally, if you have eaten or you've not eaten in the night, every sugar in your bloodstream would have been ushered into the cell by insulin, like we discussed yesterday. So for you to come after fasting and see somebody's blood sugar high, which means the glucose never even went anywhere. It has all along been in the blood vessel. It didn't go to the cell. And that is how you diagnose diabetes mellitus. And another one is you can actually have a test, what we call random sugar. Let's just say we're feeling anyhow, and you know that in your family there's history of diabetes. You just like, okay, let me walk into the hospital and do a quick check. You've eaten breakfast, you've eaten lunch, you've eaten everything. You just came in. Okay, we can do what we call random blood sugar for you. We can collect your sample even though you've eaten, and then after we come back, instead of the diagnostic value now being 7 millimeter per liter, it's now increases to 11.1 millimole per liter. When it does that, we now know that you have diabetes type. You have diabetes. This one is called random blood sugar test. That's it for now. And then another one is another lab test that we can do. Another lab test we can do is for usually pregnant women. We do what we call oral glucose tolerance tests. You come to the hospital also, you will fast overnight in case of pregnant woman. And then when you come, we will now give you 75 kg to 100 kg of glucose in the hospital, administered to you after we have taken your blood sample, the fasting blood sample, we've taken it. Then after the glucose has been administered, you wait until 2 hours later, we'll take another sample. 4 hours later, we'll take, and 6 hours later, we'll take and compare all this. Or we can collect the sample, take at 1 hour interval for 3 hours. That is, after you've taken the glucose, you do 1 hour post-prandial, post-glucose test, 2 hours test, or 3 hours test. And then, depending on the values and the figures we are there, your doctor or your caregiver will now determine whether you're diabetic or not.
Wow. So it's quite a few tests.
Yes. No, it's nothing rigorous on the part of the patients coming in. The work is on us. The only thing you need to do is don't eat. The last food of the day for you should be maybe like 7 p.m. Then in the morning, don't eat breakfast. Just come, take your sample. The rest, we'll put it together and know what is going on. So another one now, we call it hemoglobin A1C. This is for a patient who already is diagnosed of being diabetic. Now, we want to know how well you have controlled your blood sugar. And by doing so, we are checking, have you been taking your medications? Have you been avoiding the food you're supposed to avoid? So this test will check for you for the past 3 months if you have been controlling your blood sugar very well. It is also called glycosylated hemoglobin testing. It's a blood test that shows you how well your diabetes is being controlled for the last 3 months. That's it. Another way you can check for glucose is through urine test. You go, they will give you a sample bottle, you collect your urine and then keep it for the lab attendants. When they come and take it, they will now check it. If there's glucose in the urine, they will now tell you, depending, you can have 1+, 2+, or 3+, depending on how severe the diabetes is.
So it doesn't mean if there's glucose in your urine, it doesn't mean they got diabetes. It depends on the level, does it?
Yes, it depends on the level.
But there will be glucose in there.
Yes, but seeing glucose there is a suspicious index that you need to further
So
investigate.
glucose is not supposed to be there.
Glucose is really not supposed to be in the urine.
But if you don't have diabetes, what could put glucose in the urine?
Okay, if you don't have diabetes, the only thing is that either you have eaten a whole lot of carbohydrate meal the previous night that
Okay.
the body doesn't have any choice but to just excrete the excess,
Okay.
or you have kidney problems.
So is that why, if that happens in some cases, is that why they tell you to go home again and come back for another test?
That's right.
So, but this time, don't eat anything?
Yes, because it's not the gold standard test for diabetes.
Okay,
It's
okay.
just an indication,
Okay.
suggestion.
Okay.
All right. So now we are moving fully into the treatment. How do we treat?
Treatment.
Yes.
Treatment.
Treatment.
Oh, wow. I think treatment, everyone, I mean, especially on this program,
Yeah.
probably a lot of people are looking forward to this
So
part.
the treatment.
The treatment, okay.
Yes.
So,
And we are ready for you.
good.
Okay, fine. So diabetic treatment is divided mainly into 5 major parts. The first one is healthy diet. We can't emphasize that enough.
Wow. Wow.
In case of diabetes, the diet, for it to be healthy for a diabetic patient, it has to be mainly plant-based. It has to be low sugar, and it has to be low fat. These 3.
You know, when you look at a lot of people that look like, when you look at the complications and you look at the things that you got to watch out for, you talked about people that have big bellies,
Yes.
people that are fat,
obese,
bigger, overweight,
yeah.
People that, you tend to like, I think a lot of people like meat. So you're saying plant-based,
yes.
and this is Nigeria. How do you manage to, some people, obviously, they like their meat.
Oh, yeah.
So are you saying that if they've got diabetes, they need to come off the meat? Or are you saying that there's a halfway house?
Well,
what are you saying?
Well, I can understand. Every Nigerians love their meat. I love my meat too. But then there's a healthy way to go about it. If you can, there are healthy meat substitutes. You can do something like mushroom. You can do fish is not bad. You can do white meat like turkey, like chicken with the back pulled off, or you can get a Saladmaster cookware that you can fry your chicken with the back on, and it will fry, the chicken will fry itself with the oil contained in the back or the skin of the chicken. And by the time it's done, the oil is gone and you can have your chicken with the skin on it.
Okay, so what you're saying that there's a halfway house.
Yes.
Yes. Because I know that I look at a lot of people that are trying to reverse diabetes or trying to control it or manage it.
Yeah.
And I know a lot of them are focused on plant-based diets.
Yeah.
And I think what we're saying, what I can understand is that you are also saying that the plant-based diet is a diet that they need to look at.
Yes.
Yeah?
Yes.
But if they cannot see themselves just eating plants
alone,
in Nigeria, plants, what plants? Carrot, cabbage, but one of the things I find out about in Nigeria, because we're doing a lot of Nigerian shows at the moment with cuisines, with Saladmaster, because they're the sponsors.
That's
and
right.
It's interesting you mentioned Saladmaster. One of the things I found is that, if all these cuisines that we're doing, most of the Nigerian food is plant-based already.
Really?
Because when you think about it, yam, what's yam? Yeah. When you think about
rice.
spinach, what's spinach?
Yeah.
When you think about rice, what's rice?
Beans.
When you think about beans, pounded yam, they're all plant-based.
Yes.
All it is we're going. I feel in Nigeria we're just going to the extremes to add meat to the plant-based food.
Mm-hmm.
The food we want. When somebody said they want food, they say they want pandu, they want pounded yam, they want egusi soup, they want. But the meat is just like an addition. So,
that's right.
So would it be right to say that maybe they should just reduce the quantity
of
the meat? Still have a little bit of meat, but just reduce the quantity.
Or they can go for lean meats now and avoid the fatty kind of meats. Do lean meats.
But even if lean meat, if they're doing, I think in Nigeria, especially when I see a lot of the food,
Yes.
you know, in the UK, we'll have a plate this small, and you know our food. But in Nigeria, the same plate, yeah, I see a mountain, and that mountain
Yes.
represents the belly.
Oh, yes.
So if we can flatten the mountain on the plate, then we can flatten the belly,
That's right.
and then we can be at less risk of having diabetes and all these other lifestyle diseases.
Well said.
And
Well said.
and you know, just one last thing. One of the reasons why Saladmaster sponsor this program is because they want people to kind of like look at the way they eat.
Yes.
And look at the way they prepare that food.
That's right.
Because one of the things one of the things that we found out is that people eat more because there's little nutrition in the food.
Yes.
But if they were able to retain that nutrition, then the body would be satisfied and wouldn't ask for more food.
That's right.
Is that another way?
Yes, yes. If you can extract at least 90 to 93% of your nutrition of your food in you, the body will take it and be satisfied.
Exactly. So then you don't need a mountain.
No, you don't.
You see, the mountain is to get this much nutrition.
Yes.
Yeah. But this much nutrition can be even flat.
That is it.
But have a lot of it in there.
Yes, because everybody knows when you've eaten, you've just eaten food, but you know when you are satisfied or not. You still crave things passing. You're like, you just finished the meal, but you know that you're not satisfied, which means that's another way of the body telling you, I am not nourished. This thing you gave me is just garbage. Give me something more.
Exactly.
So you go looking for it. So, but with the right cooking ware, you get all your nourishment and even make the food tasty, because no matter how nourishing a food is, if it's not tasty to you, you don't want to do that.
Exactly.
Yes. Okay.
Thank you.
All right. So the treatment now, I said, is into 5 places. The first one is healthy diet that we just dealt with. Second one is physical activity or exercise. We need to exercise. It's very, very important. I'm still going to go into it in detail, but let me just name them off. Healthy diet, physical activity or exercise. The other one is your medications. If you're already diagnosed with having diabetes, you shouldn't play with your medications. The fourth one is going for regular screening. Again, checking your blood sugar and even checking at home, your caregiver to teach you how to do your blood sugar testing in the house. And then treatment of complications. These are the 5 modalities of treatment in diabetes mellitus. Okay, so now for effective treatments, first, you need to make your doctor your partner in care, not partner in crime, your partner in care. You should work closely with your doctor in case of diabetes. And then you need also to build a diabetic team with the help of your own personal doctor. Your own personal doctor can't deal with everything because diabetes affects the whole body from head to toe. So each body part has a specialist that takes care of it. They should all be incorporated and added in the management of a diabetic patient, because you have a dietitian to be involved, a psychologist to be involved, exercise instructors should be there, a very attentive nurse should be there, a podiatric should be there. Podiatrics is doctors that take care of the feet. They should also be in the treatment. Endocrinologist should be there. All of that should be there. And then an internist who will look out for complications. Even an eye doctor should be there. I know in countries like South Sudan, they work in their diabetic hospital is affiliated with the eye clinic, so that when you come, you go check so that your vision is preserved.
Wow.
Yes.
Wow. So, you know, you say like build a diabetic care team.
Yes.
Care team.
Yeah.
Care team.
Yeah.
That sounds like a lot of specialists.
A lot.
And that sounds like a lot of money.
A whole lot of money.
So,
diabetes is termed by us, the clinicians, as the disease of the rich.
Really?
Yes.
So we don't have people that are not rich with diabetes?
If you're not rich with diabetes, the management becomes very difficult.
Right.
Very, very difficult.
So if you're not rich and you have diabetes, is it terminal?
It's chronic. It's lifetime.
Really?
Yes.
So really what you're saying is if you really want to carry this thing through, then you need to have a team.
You need to have a
A
team.
team is going to cost money.
Oh, yes.
Yeah.
Yes.
Is there any? I mean, is there anything we can do naturally to help the team become less?
Of course. Of course. Like what we said, going yourself to feed yourself healthy food that is plant-based mainly, not only plant-based, but at least 90% of it should be plant-based, that should be low sugar and low fat.
Nigeria, Africa, did you hear that?
Mhm.
90% of your plate should be at least plant-based.
Yeah.
If it can be 100%, am I right? It will
Beautiful.
be beautiful.
Beautiful.
But at least 90%. Do we know what 90% means on a plate? It means your meat is in a minority.
Yeah.
And your vegetables is in a majority. So really, I think that's a fantastic one to have more spinach, have more goosey soup,
have more carrots,
exactly,
have more black beans, have more rice, the local rice as.
And you know the thing about it, if you want more meat,
yes,
just be ready to build a diabetic care team. Okay.
Yes, that's right. And then another one is make a healthy investment on yourself. For a diabetic patient, you should invest in your health. There's no gainsay. If you don't want your lifestyle to be adversely affected, you should invest heavily. There's no gainsaying it. At this point in time, when you're diagnosed of diabetes and it's getting complicated, you need to have doctor friends. Every specialty should be involved in your care. You should spend heavily for it. You should come by healthy cooking equipment that will make you cook well. Have nutrition of what you eat in order to make the condition palliative and then make life worth living for a diabetic patient.
Yeah, I mean, it's because we're sponsored by Saladmaster.
Yeah.
One of the things that they're saying is, look, we need to turn our food into medicine.
Yes.
And how we turn our food into medicine is by basically making sure we preserve the nutrition, because the nutrition is medicine to the body.
Yes.
And that's what you're kind of saying when you're talking about preparation and cooking the way. Yeah?
How your food is prepared, how it is cooked, it's all very, very important for a diabetic patient.
I like the way you say, you also said invest in your body.
Yes.
If you're not investing in your body, what are you investing in?
Nothing else.
There's nothing else.
Is worth it.
Because everything you have today is because of this body.
That's right.
And that's why we say, listen, we say the $1 billion body.
Oh, yes.
Yeah, the $1 billion body, it's more than $1 billion.
Nothing like it. Exactly. Without it, nothing else works. Okay. And then you should make your care a family affair. It's not just you. People around you, people who love you, even your colleagues should be able to look out and see the signs. So this program is not just for those who are already a confirmed diabetic patients, but for their relatives, because you need to know. Because as we said previously, there were signs there to show you that this person is going to end up as an emergency case. So when you see those signs, like I said in type 2, the person, you come close to the person has a fruity breath smell. You're like, what's going on? Did you take any fruit? It says no. That should be a warning sign. That should be a signal that something is coming. So you should preempt it. Even if the person doesn't want to know, don't disturb my doctor. You go ahead and call. Doctor, I think you should see your patient. Yes. Wow. Yes. Another one is also being consistent with your medication. Be consistent with your medication. It should be taken every day and as doctor recommended it. And then if he says you should eat, for those of you who are on insulin, you need to eat and then wait for some certain amount before you take your medication. And then diabetes is a chronic disease and it's for a long time. So people are advised to beware of depression. It can be a very depressing disease.
How do you get depressed? How does depression come into diabetes?
Oh yeah, depression comes into it because first of all, your life is changed. You don't do what you want to do. You don't eat what you want to eat. You see? And even though, like meat lovers who are down, what do you tell them? People who have sweet tooths, of course, who like ice creams and food that contains sugar, that is affected. And then again, all the time for diabetes, every morning you're you are testing yourself of diabetes, you're using needle to prick yourself to check for the blood sugar every morning. You need to be on point. What is my sugar level today? What is it tomorrow? You're in and out of the hospital. You formally, if you're someone who doesn't like being around doctors, now they're your friends. You, man, that's whole. By the time you go through the whole gamut, you some people don't come out the same.
Right.
Yes, some people don't come out the same. So it's advised that you should be aware that this can be a depressing journey. But if you listen to your doctor, you eat well and everything, it can be a very good
Right.
good journey for you. Yes, can turn it into something very good. Now, what do we mean by a healthy diet? A healthy diet, like we said, must contain 6 classes of food. But in the case of diabetes, the classes of food will be there, but the ones, there are some that need to be reduced, like carbohydrates. You need to eat now carbohydrate foods with low glycemic index. It's very important, very, very important. And then you will improve overall health via maintenance of optimal nutritional status. You should get glycemic, good glycemic control, like I've said, and then prevent this. Your diets in diabetes will say whether you will have short or long-term complications.
Yeah.
Diet alone can affect.
You know, just for a lot of people hear glycemic index, understand? And some people they're just not sure what they mean. You know, what for somebody that doesn't understand what is glycemic index and how does that relate to food? And if I go shopping, yeah, how can I know that this food is low glycemic
index.
This one is high or this one's medium. What are the levels?
Oh, well.
And what is glycemic index?
Okay, glycemic index is when you get, is a technical word, and is when you get food, it is weighed. The amount of calories in each carbohydrate is weighed, and then you arrive at the glycemic index. So normally in nature, you have food that are of low glycemic index, which means the content of carbohydrate in them is reduced as compared to some.
Okay.
Yes. Like you can have.
So you're saying it's linked to carbohydrates?
Yes, carbohydrates.
Okay.
Yes. Because you can have orange, they'll tell you orange contains carbohydrate, but no, you don't need a doctor to tell you that yam contains more carbohydrate than orange. Even if you have carbohydrate in orange, it might be in traces, just like any other food. So those are the kind of things, and that's why you also need to work with your dietitian. That is their field. They know it well, and they should be able to give you a menu to go by.
So this area, like you just said, is not a doctor's area. It's a dietitian's area.
It's a dietitian area.
So is that why they have dietitians in hospitals?
Yes, to take the burden. It's not that your doctor can't do it, they can, but to take the burden off them. Because you don't know how many diabetic patients your doctor is seeing on a daily basis. So if they spend the whole time drafting a menu for you, the other people might be shortchanged. So we don't want that.
So does it mean, just quickly, you know, when you're diabetic, your diet plays a big role now, because if hospitals have dietitians and nutritionists in the hospital, that means that the full solution is also, apart from your medication, it's also your diet.
Yes, diet is of utmost importance in type 2. Why? Because some people I know who are diagnosed to be diabetic type 2, when they control their diet and exercise, they won't even be on medication.
Wow.
Yes.
Wow.
Diet and exercise controls the sugar level for them.
Fantastic.
Yes.
Fantastic.
It is that important. So now, if you're a diabetic patient, the first thing you should do about your feeding is weigh yourself. What are you weighing right now? What? Yes, you need to know that, so that you know, am I obese? Am I overweight? Do I need to do something about it to make your journey better? Then you also target your glucose level, like we said before. What you eat, you look at that, and then you avoid trans fats. Fats you should avoid, but then processed fats you should doubly avoid. Yes, something like butter, margarine, that should be a no negotiating ground for that. So typically the food should contain 45 to 60% of carbohydrate, fat 25 to 35%, and then protein 15 to 20%.
Right.
That's basically it.
Right.
Yes. So, but you should not completely avoid carbohydrates. No, it's not advised. But like we said, go for low glycemic index foods, which if you want, you can get advice from your dietitians, and they will let you know that
You can also find it online, can't you?
it's
Yeah.
everywhere.
So, I mean, in Nigeria, I think yam is one of the
High glycemic index
Yeah.
foods. Yeah.
Yeah, so, but you can still, as a diabetic, have yam. They say yam has lower than the Irish potato, which is the English one.
Yes.
Yeah, the English one has more.
Has more,
Yeah,
yes.
and also you can make yam a little bit more healthier by the way
Yes.
you prepare it.
By the way you prepare it.
Yeah.
There's a cooking ware I met in Saladmasters that you steam yam. You don't the cooking ware enables you to steam the yam. You don't cook it. So by the process of steaming it, the yam is starched. When you're done cooking, you see the water at the bottom of the pot is all white, and that whiteness is starch. So now leaving you with yam that is more nutritious with less carbohydrates.
Right.
Yes, I was impressed with that. So you're advised to eat foods that contain magnesium, because magnesium deficiency in a diabetic patient is very dangerous. You also have encouraged to eat foods with a lot of vitamin E, because vitamin E helps to protect the blood vessels. It limits the damage that can be done to the blood vessels. So vitamin E to the diet is very, very important. So you can get vitamin E. There are so many omega-3 oils are very high in vitamin E content. There's so many things you can do. Eggs has some limited amount of vitamin E. Go online, talk to your doctor, because if I start mentioning that, you might no, you have to, the care of a diabetic patient is very closely done with your physician in the know. So anything you need to do, anything you need to change, you still need your doctor to know that you're doing that. Then also vitamin B6 and B12 are also very important for the nerves, all the neuropathies in the nerves, the tingling sensation, the numbness. Vitamin B6 and B12 will help with that. And again, the second one, we're going to physical activity. It is of utmost importance. 150 minutes of moderate exercise a week is okay. Just be consistent with it. Keep on doing it. Exercise can lower your blood sugar. Yes, it can. So keep on doing it. It is advised that you should. But before exercising, you can carry a carbohydrate snack with you just in case you slip into hypoglycemia without knowing, because the hunger pangs in a diabetic patient is much less subdued than in people who are not diabetic. So another one is you need to also consult your personal physician before embarking on any kind of exercise. Now, what are the benefits of exercise? Benefits of exercise, first of all, is it has a positive impact, like I said, on hypoglycemia, and it improves circulation. So the benefits of exercise is so much. It also improves the body's use of insulin, and then it decreases the chances of you having any complication of cardiovascular system, which is the heart. It decreases the chances of you coming down with cardiac arrest and all of that. And then exercise, when you have exercised very well, at the end of the exercise, the body releases what we call a hormone called endorphin. Endorphins are happy mood hormones. They make you happy. So when you have endorphins in your system, you are happy. So the chances of you having depression, being a diabetic, is reduced. So exercise is highly encouraged. So the next one is your medication. Insulin, pharmacological treatments. Also, we can do pharmacological treatments, and also in Nigeria, most patients with diabetes also do herbal treatment. Just discuss it with your doctor. If possibly, take it to your doctor so that they know the type of herbal treatment you're getting, and get to x-ray the contents of those the content of the herbal treatment, so that the doctor will know whether to incorporate it or tell you to stop. That is it. We call it complementary or alternative medicine. It is used by 46% of diabetic patients in Nigeria. Yes. So the treatment now for diabetes type 1 is basically insulin. You just do insulin. Anyhow you want to go about it, you go. There are some insulins that are like pumps. You wear the devices that it delivers insulin at a timed interval or to the patient. That is it. Some you inject it, but all of that, because of the injection, some have phobia for needle and all of that. So they've devised so many ways to get insulin into a type 1 patient.
Right, okay.
Yes, but for type 2, you have there are 3 treatments, like we said: healthy eating, exercise, medications, follow-up.
Right. So really, we want to do the healthy eating
Yes.
and exercise.
Yeah.
It's not all, is it? It's and exercise, I think. Should it, type 2 should be
Healthy eating
eating
and exercise.
and exercise.
Both of them.
Yeah.
Because in exercising alone lowers your blood glucose.
Right.
Yes, it
Fantastic.
lowers it, and then it makes insulin to work better.
So if you're diabetic, if you've been diagnosed as type 2 diabetes, and it's the early stages, and you've been given medication,
Okay.
maybe medication tablets as opposed to insulin.
Okay.
That's not too severe, is it? If you're being given tablets compared to insulin.
No, tablets is not too severe, and it's usually the treatment of choice for type 2 patients.
Yeah.
But for a type 2 patient who was previously on oral medications to now graduate to insulin, which means he has gotten bad.
Right.
The management and the control of the blood sugar has not been optimal.
Okay. So is it possible that if it's caught early,
Yes.
and you're putting medication, if you take a great healthy diet and you exercise,
Yes.
you could probably come off the medication?
Yes.
Oh,
I know
fantastic.
so many diabetic patients who are just living on good diet and exercise. They are not on any medications, yet they have type 2 diabetes.
Wow.
Yes.
Wow.
Yes.
I think we just need to catch it early.
Yes,
Catch it early.
that's the thing. Catch it early. That's why frequent screenings is advised.
Yeah.
Keep screening so you can catch it early. If you catch it early, something can be done about it. But when it's complicated, there's little anyone can do.
And some people actually know about it early.
Yes.
But they don't take action. They carry on eating the foods and the drinks and so on.
No, that will make us think that the person is on a suicide mission.
Yeah.
Okay. So basically, this is we are about to wrap up. We're already wrapping up. We've done the complications and we've done the treatment, and now prevention. From what I've said so far, the prevention, anybody can get towards the prevention. Yes, right. Of course. It is healthy eating, plant-based diet that is nutritious, that is low in sugar, that is low in fat, and that is low in meat. In as much as you like meat, you might not run away completely from it, but you should really decrease.
Right.
And find substitutes to meat.
Yeah. Wow.
And then the other one is exercise. It makes you a better patient. It makes you respond better to insulin. It makes your blood sugar better controlled. Exercise is of utmost importance.
Is there any type of exercise that's probably good for them?
Yes, they do aerobics.
Aerobics.
Yes, they do.
So
aerobics.
is it cardio exercise good for them?
Well, cardio is not contraindicated, but before anybody embarks on cardio, your doctor should be
checking.
Oh my God!
Because I do one cardio. This cardio is, I'm telling you, it's hard.
It is.
And I tell you, if you don't have a good heart,
if you don't have, don't attempt.
It might not be diabetes that catches you. It might be your heart that catches you.
Yeah. And the thing is, if you have diabetes and you're on cardio, you don't know how complicated it is. So before you take such a move, your doctor should be.
It's advisable before you go on a diet, talk to your dietitian, talk to your doctor.
Yes.
Before you go on exercise, make sure you talk to your doctor to make sure that it's not going to have any other complications with your.
That's right.
Okay, great.
That's right. So that is it for today. Like we see, the fruits here, like a diabetic patient, some people say a diabetic, I meet some diabetic people, they keep on taking just cucumber. No, there are a whole range of fruits you can take, but the thing is about quantity.
Wow.
Yes,
Wow.
quantity.
Well, I think today's show, I've learned more and more. I was saying to someone yesterday, someone saw me on the TV program yesterday, and they were like, "Tony, you were focused." And I said, "Yeah, I was focused."
Oh, yeah.
And one of my friends said, "You didn't like biology in school." I said, "Yeah." I said, "I didn't like biology, but I enjoyed the diabetes." And I said, "Now not liking biology in school is my punishment now."
Oh my God! So
but
you
it's not funny. I don't feel punished though. I feel like I wish I did biology more in school.
That's what they should do.
It's good. And I think Marvel also might have some questions for us from yesterday and from today.
Okay.
Marvel, we're just about wrapping up. So is there any questions you have for Dr. Dolly? If there are any questions, please let us know.
Okay.
And so on.
Thank you. Thank you very much, Dr. Dolly. Thank you, everyone, for coming on this show. It's been enlightening, is what someone has said. They've learned a lot from this show, and we have lots of people connected. So thank you again, Saladmaster, for sponsoring. Now, we have two questions, Dr. Dolly. The first one is actually from yesterday, and I think they've reposted it today. They're asking, what's the connection between starch and diabetes, or starchy foods and diabetes? And how can we control the intake of starchy foods in Nigeria or in Africa? And I'm just going to ask the second question together with the first one so that you can take them both together. Now, the second person is asking, what's the difference between a dietitian and a nutritionist? What's the difference between a dietitian and a nutritionist? So those are some of the things that our guests on the call tonight want to know. So I'm going to hand it back to you now in the studio so you can deal with it. Thank you very much again. Over to you now.
Okay, thank you, Marvel. Thank you for those wonderful questions. Okay, I'll start with the first one. The first one says, what is the connection between starchy foods and diabetes? Well, what we call starch is actually carbohydrates. And carbohydrates, when you break it down, it gives you glucose or sugar. Now, that is what is seen in their blood. When you take the blood sample of a diabetic patient and you take it to the lab for analysis, you now see that they have high blood sugar. So that's the connection. Diabetes is basically a disease where sugar or glucose is not metabolized very well. So that is it. Starch is carbohydrate. Starchy foods are foods that contain carbohydrate. And diabetes is a disease of metabolism, that is the breaking down of glucose and utilizing it for energy. There is a problem in the pathway. And like I said yesterday, it is because diabetes, in a case of diabetes, the insulin in type 1 is not produced at all by the pancreas. In type 2, it is produced but not adequately. And if you have abdominal fat or you're obese, the insulin becomes resistant. The insulin is there, but it wouldn't usher. Like yesterday, I said, let's take insulin as an usher. It ushers glucose, that is the end product of starchy or carbohydrate food, into the cell. Now, when insulin cannot be able to usher glucose into the cell, the body is starved. It can't fight for energy. It can't grow. It can't be nourished. That is the connection.
Wow.
Yeah.
Starchy food.
Yes, starchy food is another name.
So like you said, we have in Saladmaster we call it. You said steaming because that's more graphical. People can understand the word steaming. But in Saladmaster, we call it a moisturizer.
Okay.
And what happens, like you said, is we put the yam or the potatoes in there, and what happens is it actually goes through, and then it pulls the starch into the water. So what you're doing is destarching it. You're making it more healthier for somebody that's diabetic.
Yes.
All right, okay.
Yes, you destarch the yam. If you can destarch most of those high index carbohydrates, diabetic patients can eat it.
Fantastic.
Yes.
Fantastic.
Then the second question, if I'm not mistaken, is what is the difference between a nutritionist and a dietitian?
Oh, that's a good question.
Oh,
that's
yeah.
a good question.
Oh,
That
yeah.
is a good question.
Yeah,
Because I get
the
confused.
person that asked it is really thinking.
I get confused, but
Mhm.
can I guess? Can I guess? Let me
Okay,
see.
please do.
One focuses on diet
Okay.
and one focuses on nutrition. Joking.
That's a good attempt, really. That's a good attempt. But let's put it this way. A nutritionist is someone who went to the university and studied just nutrition, nothing else. A dietitian, on the other hand, is someone who went to the university to study medicine and surgery. You're already a qualified doctor, then you come and specialize in diet, calling you now a dietitian. So the difference in both, they deal with food, but the difference is that this is already a qualified medical doctor who now wants to know in depth about food, and they now go on to study dietitian, study diets, now making them dietitians. And you see that for a dietitian, the study of food goes beyond fruits, vegetables. No, they now go to the chemical components of these foods. They go in depth. Dietitians will touch the chemical components and all of that peripherally, but the dietitian goes in depth.
Okay, you said dietitians twice. Which one is it? Is it nutrition?
No, the nutritionist is the person who just did a BSc in nutrition.
No, when you talk about chemical composition.
Okay, chemical composition.
You said the dietitian will
go
into
in depth to the
then,
extent that they have in-depth knowledge of the chemical compositions of food.
Okay.
And because they're already doctors and they already know the pathology of diseases in human, so they can marry it perfectly.
So they're going to. So who doesn't go in depth with the
nutritionists don't go in depth as dietitians.
So they just look at the general.
They look at it,
but
then they might, in their own argument, they might say, we look at food in every aspect. Fine, I give it to you. But the main difference here is that one is a doctor, one is not.
Okay. So really, I must be, correct me if I'm wrong.
Okay.
But I think I've met dietitians that are not doctors.
Dietitians are not doctors.
I don't know. I'm just assuming.
Yeah, no, they are wrongly termed if you're not a medical doctor. It's just like going to the hospital and you meet an optometrist. Optometrists are not doctors, but they deal basically with glasses, lenses, and all of that. So when you go and they look at your eyes and give you glasses, you think you've met an eye doctor. No, an eye doctor is one who did medicine. After doing medicine, you now go and specialize in ophthalmology, and they are called ophthalmologists.
Okay, so
that's the difference.
So if I'm right, then a dietitian is a doctor that specializes in diets.
Yes.
Yeah.
A nutritionist is
a
non-doctor.
It can be a doctor too, but if they want.
If you want to get your degree in nutrition, you can go ahead and do that.
But you can be a nutritionist without being a doctor.
That's it. No, you can't be a dietitian without being a doctor.
You can't be.
You can't.
Okay.
Yes. Okay. It's just like you cannot be an ophthalmologist without being a medical doctor first.
Oh, I've learned something today. Yeah. I've learned something today. Yeah. Okay. So Marvel, did you get those answers?
Wow. I must say those answers were very precise. I believe our guest on the call tonight, I've really learned a lot from Dr. Dolly, sharing lots of medical stuff, nutritional stuff, and of course, healthy tips and recipes with us tonight. Thank you, of course, Mr. Tony. For now, we don't have any questions. Over to you guys now in the studio.
So I'm going to give Dr. Dolly, do you want to say a final summary,
Wow.
Answer?
The final thing I'm going to leave with the people is, before we wrap it up today, is first of all, invest in your diet, invest in your cookware. Go in depth and see how your food is prepared. It's very, very helpful in preventing a whole lot of diseases and curing lifestyle diseases, which diabetes is one of them. Secondly is activity. Exercise is very important to human existence. You should exercise. We're given legs to move, hands to move. We're not meant to be sedentary beings. That is not it. And another one is also taking care of you generally, going for screens so that anything you have that might want to creep up on you is caught in the bud before it does any damage to your system. Your billion-dollar body. You shouldn't let anything creep up and spoil what you have.
Well, just like Dr. Dolly says, your billion-dollar body.
Yes.
You know, one thing I like to say, thank you, Dr. Dolly, for the
My
information,
pleasure.
and we're looking forward to the next show.
Yeah, me too.
yeah. And you know, another thing I'd like to say is thank you, Saladmaster, our sponsors. You see this machine here? This machine is a Saladmaster machine. Any of you that are on this show right now, if you want to see how you can get one of these machines, please leave a comment so that somebody can get to you, or send a private message so that somebody can get to you. Now, we're doing these at the moment on promo because Saladmaster is sponsoring the program. So Saladmaster, because they're sponsoring the program, they've allowed myself and Dr. Dolly to be able to give these complimentary ones away free.
Oh,
so
yeah.
find out how you can get a free Saladmaster machine. Just mention Dr. Dolly and they'll tell you how you can do that. The other thing I'll say to you is, you know what, Dr. Dolly talked about it, the billion-dollar body. You know, Dr. Dolly talked about diabetes today, type 1, type 2, gestational diabetes.
You're doing quite great.
I'm getting there. I'm
Oh,
getting there.
yeah.
I'm getting there.
Oh, yeah.
You know, one thing I'll say to you is it's not the end of the world if you have diabetes, from what I can hear. But guess what? It's not the end of the world if you take action now. So any of you that have diabetes or have been affected by this show, please take action now. Action now. Go and see your doctor. Make sure the doctor checks you out, check the family out, and just protect yourself. Remember, one of the things that Dr. Dolly said today again was COVID-19. COVID-19 is out there, it's real. Being diabetic puts you at risk. So really what you need to do is protect yourself as a diabetic by taking regular checkups. And you said, check your sugar levels, make sure you're fully protected. Because at the end of the day, we've got the gloves, we've got the hand sanitizers, but guess what? Our immune system needs to be strong. So really, what we would advise everybody on the show to do is see one of our health and nutrition presentations. Dr. Dolly is going to be doing some of those also for us, for Saladmaster, because she has a wealth of knowledge and she's going to be delivering some of the presentations. So if you want to see a Saladmaster presentation by Dr. Dolly, let us know, yeah? Because she's looking at me and saying, wow, I would love to get my hands on that. And guess what? It's virtual. It's virtual. So that means you don't even have to come into the office. In our office also, if you want to come to our office, we do social distancing. So guess what? You can come into a private studio room with a private kitchen with somebody be able to share with you the nutritional benefits and also the health benefits. And who knows, you might even have Dr. Dolly there.
Oh, yeah.
Am I right, Dr. Dolly? Yeah?
Yes, you're very right.
So really, just like to say thank you very much. This is our billion-dollar body show.
Yeah.
And thank you very much. Take care of your body, because this body is the only vehicle that's going to take us through life. Yeah. So you want to treat this body with care. Yeah. That means you want to make sure what you fuel put in this body takes care of the body. That's what Dr. Dolly is really saying. So thank you very much. Thank you, Dr. Dolly.
Thank you.
And good night.
Good night.
Good night. Thank you.
Good night, everybody.